All right, next we're going to be discussing some progressions for an upward sliding dysfunction. So that typically means the patient has a lot of problems in the back and in the legs when they flex the chin. So remember, when you flex the chin, we're pulling the cord up. So if here's the spinal cord and here's the nerve roots, the disc is now on top of the nerve root, or what's called an overhook. So when we try to go up with sliding the cord, it creates the irritation there. So again, when we go with neck flexion, it's no longer to slide up, hitting that overhook. So we're going to discuss some progressions here. The first one, just to get some symptomatic relief, is we'll extend the neck, taking pressure and not pulling it up anymore. And we're also going to extend the knee. So when we pull or extend the knee, everything here, both of these techniques will pull the cord down and get off of that overhook. Following this, the next progression is we're going to keep the neck extended and we're going to glide the knee. So we're going to come up a little bit higher with the knees and straighten that right and bring it back, keeping the ankle at 90 degrees if it's possible, just like so. Next progression after this is we're going to just slowly flex the neck until we hit a little bit of that reaction. Once we hit it, we'll back off slightly. Holding that position with the neck, we're going to get back into the gliding with that right knee to start teaching everything how to slide and move properly. After this, we're going to hold the extended position of the knee. So again, we're pulling down away from that overhook. Holding that position, we're then going to move the neck. So flexion and extension. We're teaching it how to move properly from the upper limb here. Perfect. And then the next progression is doing the same thing with the neck. We're going to continue to move it, but just holding the knee in flexion. So hopefully this will restore an upward sliding dysfunction. The last one, we'll go back to that seated position. So this is exactly the same as the downward sliding dysfunction because both of these teach the whole entire cord and sciatic nerve to move properly. So what we're going to do is we're going to look up and straighten that knee and ankle at the same time, and then everything will go down. And we'll repeat this here for about a solid minute.